Good evening, everybody, and welcome on this very hot evening, probably the hottest evening of the year. So thank you for joining us. Today we're going through webinar 4, CQC registration, how to navigate the registration process successfully as a new practice. This has been a really hot topic during our webinar series. We've had lots of questions about CQC, so it's a bit of a bonus one that we've kind of tagged on to the end of June before we take a break for the summer. We are recording today's session. We will stop at the end of the presentation, which allows you time for kind of Q&A. Please use the chat function or the Q&A function to ask questions. There'll be plenty of time for questions at the end. So there's about a 25-minute presentation. I think we've got about half an hour for questions. So I will get started. That's okay with everybody? Okay, so if you haven't attended these webinars before, it's a new series we've been running starting back in April, all about how to guide you through the essential steps to achieve success in setting up, launching and growing your practice. So they've been really designed to help you really understand the various stages that you'll go through when you're setting up your own private practice, from that initial kind of planning stage through to kind of launching and then growing your practice, and then how to run it as a successful and thriving practice. So it's designed really to help you avoid some of the common mistakes that are made that we hear about from our clients, help you save time and money by giving you some useful insights. And ultimately what we want to do is to get you to launch sooner so that you can start bringing in revenue for your clinic. So who is Designated? If you haven't heard of Designated Medical before, we are a business that's been around for about 13 years. We provide healthcare businesses with wraparound support services to help them on their journey to establish, launch and grow their practices. So that includes a medical PA service, medical billing, marketing, accountancy, bookkeeping, and general consultancy. This is what we kind of specialize in. So we're here to support you any way that you need through any part of your journey to help you become successful. So our speakers this evening are myself. So I am a health and wellbeing startup specialist. I've got too many years of operations and marketing experience, but I set my own business up about 5 years ago to help support healthcare practitioners set up and launch their private practices. We're very lucky to be joined this evening by Gabby Ashton, who is the star of the show this evening. She is our resident expert when it comes to CQC. She used to be a CQC inspector and has then moved to the other side and now works independently for Let's Get Lemonade. And she provides invaluable support regarding registration advice, training and development, compliance relating to CQC, which is obviously changing a lot. We've got the new self-assessment framework, which Gabby will talk you through this evening, which is why we've had so many questions. Also delighted to be joined this evening by Jane Braithwaite, who is the MD and founder of Designated PA and Designated Medical. So Jane isn't presenting this evening, but she will be around for questions at the end. And she has a huge amount of experience, so I'm sure she'll be able to answer some of your questions. Now, if you haven't attended the previous webinars that we've been running during April, May and June, webinar 1 was all around the preparation that you needed to do when you started to think about setting up your private practice. What are those steps that you need to go through, from business planning and budgeting through to touching on kind of CQC, touching on value proposition, why is your clinic going to be different, how's it going to succeed. Webinar 2 is all about the launch and how to market your practice. So once you're up and running and you're through that CQC process and you can start seeing patients, where are you going to find those patients, the importance of a good website, and looking at the various marketing channels that you may need to use to attract and grow your practice. And webinar 3, which was earlier this month, was all around how to run a thriving practice. Once you're underway and you're up and running, how to make it run efficiently without a huge amount of admin or firefighting, and how to understand the finances and key performance indicators to ensure that you're driving the practice forward and it's continuing to grow and being successful. So we have got recordings of all these webinars available if you've not seen them yet. So if you do want to see them, then get in touch. Our email address is at the end of this slide deck. We will be in touch afterwards as well. So happy to send the links to those so you can look at them in your own time. But today is all about CQC registration. And like I said, Gabby will be going into great depth in this, and we hope it'll be really invaluable for you. So Gabby, I think hand over to you at this stage. I think one caveat here was that obviously CQC, things are moving on a regular basis. There's always updates, which Gabby will tell you about. So everything that we're presenting today, because we're aware that people will be watching the recording is valid and relevant based on today's date, which is the 26th of June 2024. And I'll now hand over to you, Gabby.
Great, thanks, Simon. And yeah, thanks everybody for joining. It's nice to see so many people on the call this evening. So yeah, during today's presentation, we're going to look at the following areas of CQC registration to support you in understanding the process. So we'll have a look at preparation, sort of looking at time involved, documents involved, and some of the processes that you need to get right behind the scenes before you're ready to submit. We're also going to take a look at practicing privileges, which I think we'll do first, and that will then enable those on the call to understand whether or not CQC registration would even apply to you, or whether you are covered by practicing privileges, as it is something that we come across quite frequently where there's a misunderstanding about that particular area, and then work either is or isn't done in the right sort of order or in the right way for that. We'll then have a look at some of the common mistakes that we come across when we're supporting clients with registration, and some mythbusters as well. So maybe things that you've heard, we can try and provide the most up-to-date and the correct answers for those. Then we'll have a look at what happens once you press submit. So via the online portal, once your CQC application is in, we'll look at next steps, which include getting interview ready, so making sure that you're prepared for your CQC interviews, and then looking at what happens after you are successfully registered. So we'll run through the whole journey for you today. So if we move on to the next slide, we are going to start by looking at practicing privileges. So as I've mentioned here, this really is just to support providers or to support clients to understand whether or not you yourself need to register with the CQC. As Simon mentioned, the single assessment framework has recently been, well, it's June now, but since the start of the year, it's recently been introduced, and we're seeing that rolled out at a much quicker pace now for providers. And for those of you who have had a chance to look at any of the information about the single assessment framework, we know that the information and the guidance and the data is changing at quite a quick pace. So we need to keep on top of any changes that happen from a registration process. We've just mentioned there that the CLOEs, the key lines of inquiry, are no longer relevant, and we just wanted to make that point as early on as possible in the presentation. When we're speaking with clients or providers, we often hear them reference the CLOEs, the key lines of inquiry, and it's really important that we understand and take away from this webinar that the CLOEs are no longer relevant, they're not applicable, the CQC are not using them. So that will have an impact from an application process, a policies and procedures process, and when you are going through your registered manager interview as well, please do not mention the CLOEs. So when we're looking at practicing privileges, we've got just some high-level information here for you about what the CQC defines as practicing privileges, which is a well-established system of checks and agreements to enable doctors to practice in hospitals without being directly employed by them. So what you will need to do is understand whether or not you are renting consulting rooms to conduct private appointments in an independent hospital, or if you're subcontracting and looking at the arrangements that come with subcontracting and with renting as well. So practicing privileges are different to normal renting and subcontracting arrangements because they have a specific exemption within the Health and Social Care Act of 2008, which is the main piece of legislation that the CQC inspect and regulate under. So in order for the exemption of practicing privileges to apply, all aspects of your consultation must be carried out under the hospital's management and policies. So an example here is that the consultation that you provide as a clinician must meet the hospital's requirements for clinical governance and audit. And you as a consultant must follow the policies and the systems for things such as complaints, record keeping, any governance that applies to the consultation, and the hospital will own the records. So it's just being really clear about whether or not that would apply to you. If we move on to the next slide, there's a bit more information here about doctors or other clinical professionals, other healthcare professionals can also sometimes practice in outpatient departments under their own arrangements where the hospital acts as a landlord only. So you could have it that the hospital is running everything from a regulated activity point of view, or you could have it that the hospital is acting only as a landlord, or it could not be applicable at all if you're renting from a different space. So where this happens, and the hospital have clearly advised that they are only going to be acting as the landlord, and that you as a doctor or other healthcare professional will be carrying on your regulated activities, so your consultations and your work with patients independently, then you must register with the CQC, because that's not counted as practicing privileges. And where that applies, so where you will be just renting out a room or the another existing CQC regulated service acting only as the landlord, you need to make sure that you've got really clear arrangements and processes in place. So here they will set out the extent of their role in agreements with you as the service provider. That might be a contract, a service level agreement, or a practicing privileges grant, depending on what's applicable. And just to remind those that if the extent of responsibilities is left unclear, then what happens is that landlords will sometimes end up being held responsible for activities taking place if nobody else is responsible for them, which I'm sure you can all appreciate then lends itself to quite a messy space in terms of demonstrating compliance and providing safe, effective and caring care and treatment to your patients. So please do your research before you look to do CQC registration. Have those conversations with the space that you'll be accessing, and making sure that you are really clear about whether or not you do or do not fall under the practicing privileges scope. So presuming that those on the call are aware that they then won't be falling under practicing privileges and are looking to register with the CQC, just some really kind of a brief summary here for you about the key points to that. So CQC registration is mandatory, or a mandatory process for all healthcare providers in England. So remember, it only applies to services provided in England. And this is to ensure compliance with the Health and Social Care Act of 2008 that you'll probably hear me mention quite a few times today. So when or where you apply for your CQC registration, so this is now all done via the online portal. Historically, you may, if you've been previously CQC registered, or if you know people that have been, you could have accessed that via the Word documents and then emailed them to the inquiries team. But the CQC are now encouraging everything to be done via the online portal. And I have done a handful recently, sort of in the last 4 to 5 weeks, 6 weeks maybe, and they've all been successfully done through the portal. What I would say, though, is when you are preparing information for the portal, please make sure that you keep a copy of all of the information that you are submitting to the portal in a separate document, whether that be an Excel spreadsheet, a flowchart, a Word document, a notepad, whatever it is, just in case the portal, for whatever reason, isn't playing ball on the day that you're looking to submit, and that means that you won't have lost any of your work. Then, in terms of time taken to manage your application, once you've logged onto the portal, it can take anything between half a day to a day to submit, just depending on how prepared you are. And that's purely because there are a lot of questions to answer. So provided you've got everything ready in advance, it's purely a case of copying and pasting that information over to the portal and working through the multiple tabs that they will lead you through. But the key thing is the preparation that you need to do in advance of logging onto the portal. And that usually can take several weeks. Again, depending on how prepared you are and how much access you already have to things like policies and procedures, whether or not you've had an opportunity to think about the visions and the aims and the objectives of your organisation. So we tend to say, sort of allow yourself between 4 to 6 weeks to get ready for the CQC. That's presuming you're also probably working as well in providing clinical support already. So that will allow you the time to prepare and then upload to the portal. There's also just a really brief snapshot here of the fees that are associated. That's a really common question that we get, is how much does it cost? So these are the fees, as Simon mentioned, accurate as of today and yesterday, but please do regularly check if that link that's provided, or when you're on the CQC homepage, to have a look at the fees to make sure that you are familiar with what the requirements would be for that. So in terms of how to prepare, as I've mentioned, policies and procedures, in this middle of the screen here, you'll see that where it says all policies and procedures. So these are the documents that will be required for anybody, any independent or private clinical service that is registering with the CQC. So regardless of whether or not you are online service, regardless of if you're looking to specialise in a particular area, it doesn't matter. These are the fundamental documents that you will need to submit as part of your application on the portal. So you'll see there are quite a lot in there. It's not just a handful that you need to get right. There are a large number that you need to have oversight of, that you need to make sure have been personalised, bespoke to your service, and that you are aware of the details within them. On the right-hand side, you've then got an additional list that are required for online services. So if you're looking to provide both face-to-face and online consultations, you'll need to submit both boxes essentially. So all of those on the right-hand side and in the middle. But obviously, if you're just face-to-face and you're not online, then the right-hand side won't apply to you. On the left-hand side, it's just a brief, again, overview of the additional details that are required as part of the application form. So I mentioned that when you log on and you work your way through the steps and the different tabs that the CQC portal provides for you, one thing that you have to do is, those people may be familiar with a statement of purpose, or the term a statement of purpose. Every CQC registered service needs to have a statement of purpose. In the past, that was a 4-part Word document that you would email to the CQC. But now the CQC portal asks for you to provide information about the aims and objectives and how you will meet the quality statements. And then what they will do is combine that with all the information that you're submitting and create a statement of purpose for you. So it's a very similar process, just a slightly different way of doing it, or similar outcome, sorry, but a different way of doing it. So for the aims and objectives, you can write up to 5,000 words. It's important that you know that this is up to, because we're very, on the CQC, obviously proportionate in the sense that if you're a one person band, if you're just looking to do, if you're looking to start up by yourself, or there's only a couple of you that are looking to start a business, you won't necessarily have 5,000 words to say about your business. And in addition, they also ask for 3,000 words per quality statement, of which there are 34 quality statements. But again, you don't have to write 3,000 words per quality statement. It's just that's the maximum word limit that you can have. So when you are looking to write all of these out in advance on a Word document, just make sure that you're keeping an eye on the number of words that you're using, so that when you copy and paste, you don't go over that threshold. With regards to how you will meet the quality statements, so what that means for people, the quality statements, as I mentioned earlier, there are 34 of them that have now replaced the key lines of inquiry. The quality statements cover all of the fundamental topics that we'll be familiar with in our line of work. So looking at safeguarding, for example, infection control, freedom to speak up, governance, looking at complaints or listening to people and receiving feedback. So you will have to provide a response to the CQC about how you will meet that. So for example, what your policy says, what training you'll be providing to your staff, what your induction process might look like, your ongoing supervisions or appraisals for colleagues, the audits that you might undertake, if you're working with contractors, what that relationship looks like in terms of from a compliance perspective. So that's your opportunity to talk about how you will demonstrate compliance and how you will maintain ongoing compliance with the 34 areas that the CQC are now looking at. And then the logistics part, that's quite straightforward. That's just things like your name, your contact details, the regulated activities that you'll be looking to apply for. But as I said, just make sure that you have that in advance, so that when you go to complete your application, you're not kind of, flustering a little bit with which ones to tick. So if we move on to the who, so this here is really just for you to have a think about in terms of the legal entity that you will be setting up when you register with the CQC. So the legal entity is otherwise known as the provider. So you may hear CQC inspectors or friends, colleagues, other people in the industry talking about things such as, are you an individual? Are you a partnership? Who's your nominated individual? Who's your registered manager? Who's your nominated person? So there's lots of terminology that's used depending on the legal entity that you are registering for. So as a provider, you can either be a partnership, an individual, or an organisation. The most common that we come across is an organisation, but of course you don't have to be. That's just one of the 3 ways in which you can register. And the provider, aka the legal entity that you are registering, doesn't relate to how many contracts or locations you have. It's purely just the legal entity in which you are registering. And then it's the overall service provider, like I said, that must register, not the individual premises where the care is provided, and nor does it relate to the individuals working there. So when you apply to register, you're essentially, if you imagine it in an order of play, you're essentially registering as a provider. Then you will add the locations on. So those are the places in which the regulated activity will take place from. And then you will, as part of your application, demonstrate or apply for the right people to deliver that. So that's when the nominated individual and the registered manager come into place. So just make sure that you're aware and have an understanding of your legal entity before you open up the portal to apply. With regards to the nominated individual and the registered manager, we can see here there's just a very quick, in brackets, link to the regulations. So again, before you look to register, please familiarise yourself with the Regulation 6 and Regulation 7 of the Health and Social Care Act. They're not too lengthy, don't worry, it's fairly kind of manageable to get your head around. But what that does is make it really, really clear about the roles and responsibilities that are required. So what I would say is, if you're going into partnership with another person, so if you're not just working or setting up a service by yourself, regardless of whether or not they're a clinical lead or an operations lead, if they're going to be your practice manager, your office assistant, whoever it is that you're going into partnership with, be really clear and have those conversations in advance of applying to the CQC about what you imagine your roles and responsibilities to be, and who has the capacity and the capability to oversee governance and the regulated activity. So, for example, if you've got a clinical lead and an operations lead, and the clinical lead, isn't particularly passionate maybe, or doesn't have the time to look at governance, but it's something that your operations manager is really keen to develop in, then that might play a role in who would be the nominated individual and who would be the registered manager. Equally, if you're thinking about who might be working part-time, full-time, looking at external kind of factors, think about all of those and make sure that you're really clear about how you're going to work together and how you're going to support each other, but ultimately have an understanding of who will carry legal responsibility under the two different roles. So if we then have a look at mistakes and mythbusters. So we'll just focus firstly on DBS checks, the disclosure and barring service checks that you'll all be familiar with if you're registered healthcare professionals. What's important is that when you apply to register with the CQC, a DBS check that you have must be no more than 12 months old. So if you get to the portal, you're ready to submit everything, and then you go to send your DBS and you realise that it's 12 months and 2 weeks out of date, or 12 months and 2 weeks old, your application will be rejected. So please bear that in mind from a timeliness point of view. We spoke earlier about the time it takes to prepare and then you submitting your application. If your DBS is at 11 months and 3 weeks old, I'd recommend applying or getting a refresh DBS just so that you allow yourself that time to get that right. If you are already a registered healthcare professional, so you have an existing DBS, that's absolutely fine to use. So the third bullet point down gives you the list of healthcare professionals registration kind of forums. So as long as you're already registered with one of those, you will have a DBS and you can submit that as part of your application. But if you are not a registered healthcare professional, so for example, we spoke earlier about if you're a non-clinician and you're looking at from an operations perspective, you will need to apply for a CQC countersigned DBS, which can take up to 60 days to return, and you can't submit your application without this. So again, please factor that in to your planning and your time. Please don't get to the application submit stage and then realise that you haven't got the correct DBS in place. So as part of your application, as I mentioned, with your DBS, you have to send your original copy to the CQC. It can't be a copy, it has to be the paper version. And when you post your DBS, so you will be prompted on the portal, after you've gone through about 90%, 95% of the information, you will get a prompt to post your DBS to the CQC, National Customer Service Centre. But please bear in mind that it can take up to 4 weeks to receive back. So if you think that you're going to need that DBS for anything else, for example, if you're going for an interview, you might need, proof of ID for something outside of work, then please just make sure that you take a copy, because you won't be able to chase the CQC for that once they've received it. just to be really clear, if you have a CQC countersigned DBS, so for if you're not registered with the healthcare service, and you've had to apply for a countersigned DBS, you don't need to send this unless the CQC request it in writing. So it's only for the original DBSs that you would have to post that. Hopefully that makes sense. And then please make sure that your DBS check has your current name and lists any previous and legal names. We do see that as well, where there might have been a name change and you've put your new name in your application form, but you haven't provided previous names or legal names. And then if there's a discrepancy between your DBS and your application, it will get rejected. And then just make sure that you've got your professional body and registration number to hand so that you can include that in your application. So other common mistakes and hopefully some top tips to support you. I think I've mentioned earlier, and I will probably always mention this, it's really, really important that you know your own policies and procedures. So if you're looking to outsource access to policies and procedures, or if you're bringing them from a previous role that you have had, it's not, and I know it probably sounds silly, everyone would think, who would do that? But it's a surprising amount of people who rely on historic policies because, you know, we've come from another healthcare provider that got a good rating, or we've had a consultant do this for us, so we haven't felt the need to check them. Please check your policies and procedures and know them. What I often find is that when I get to where I probably work with a client slightly later on in the game, in the process, and they get to their registered manager interview preparation, I will have had a chance to review policies and procedures in advance, just in the same way that the CQC registrations inspector will have done. If you're going to be then quizzed on them and you don't know them, or they incorrectly reflect what you've said in your aims and objectives and your values for the business, that would be an immediate red flag that you haven't managed governance and compliance from a safe perspective. So just make sure you know them. The second one is the CQC application does require you to have a website. However, we have for a couple of people that I've worked with recently and had assurance from the CQC that because of the weights and the understanding that from a business perspective, it's not always viable to have that up and running before you're registered, you can just simply put the CQC's website in there instead, so www.cqc.org.uk, and then simply say in your application that you plan to purchase a domain or get your website up and running once you've registered or in a certain amount of time. Another area is leaning on the landlord or the site that you're working from, so for risk assessments. Again, a common thing might be when we look at fire safety, when we talk about business continuity plans, when we talk about data management, if you're sharing software or devices with anybody, from a landlord perspective, accessibility, comments that you sometimes hear, oh, well, that's the landlord's responsibility, we don't have anything to do with that. That's not sufficient, and it's really important that, yes, you won't be overseeing everything and you won't be managing things to a degree if you've got a landlord in place, but you need to know what the risk assessments are and what the policies and procedures are. You can't induct a new staff member or you can't onboard new patients and not know how the running of the site will look from a safety perspective. Another important reminder is to make sure that you know the CQC framework. Simon and I have mentioned the single assessment framework, and within that it's made up of the fundamental standards, so the regulations that the CQC work towards, and the 34 quality statements. So as part of your application process and as part of your interview, please make sure that you've familiarised yourself with those and that you have an understanding of how you're going to meet them. Another common pitfall that we see is not being clear about the role of the registered manager from an oversight perspective. So there's no denying that being the registered manager is a lot of work, and it does take responsibilities that you may not have anticipated. So please bear that in mind, and as I've mentioned earlier, please consider that as part of the application. But the registered manager does have a legal responsibility to oversee the regulated activity. So although there's, we can talk about this in many different ways, there's always ways to delegate, obviously, and work with your team. But what you can't do is pass the buck from a compliance and a safety point of view. So it's really important that you maintain oversight and that you've got enough time in your week, you've got the correct systems in place to be able to manage that effectively. And as I mentioned earlier, the key lines of inquiry, still seeing quite a few policies coming our way that have, probably a little bit of a fancy add-on at the end where Chloe's are referenced. So your safeguarding policy would reference, the particular key line of inquiry. It's no longer relevant, and actually that just demonstrates poor practice because you're not showing that you're up to date with the current way of working. So try not to fall for that and try not to include them, please. So in terms of getting everything ready, we've talked through that. We've talked through some of the common things that could go wrong. At the very end of your application, you will then press submit. And unfortunately now there is a wait. People, again, don't always anticipate the length of time that the waiting time that we're seeing for healthcare at the moment. It's 6 to 8 months. So the conversation that I had with a registered manager, a client who went through the registered manager interview a couple of weeks ago, they submitted mid-October and they had their interview mid-June. So that was an 8-month waiting time. So once you press submit, you will receive an automated email confirmation on the submission of the application only. It won't contain any personal information. It won't be an introduction to the CQC or an inspector. There probably won't be any further questions. It will just simply be an automated email with a reference number on it. And then everything will go quiet. So you will not receive any other acknowledgement from the CQC. You can log into the portal to check the progress, but as I mentioned, nothing will change for some time, so there won't be a huge amount to look at there. The main thing to keep in mind is that the email address that you used in your application is key for the next steps. So just double check that if your acknowledgement went to your junk mail, you can click the button that says this isn't junk, and you can allow future emails to come from the CQC. Please make sure you do that so that you don't miss any correspondence that comes next. And please do not change your email address midway through. So during that 8-month period, don't change your email address, or if you do, make sure you still have access to the one that that you've submitted in the CQC application. It's not an easy process to change information like that once an application is pending, so keep an eye on that. So then, as we've said, approximately 6 to 8 months later, you should be contacted by a registration inspector, and at this stage they may ask you for further information about your application. They may, depending on the type of service you've applied for, look to arrange a site visit, and then they'll also want to arrange an interview date. So there'll be a few topics to discuss within the email that you receive from them. In terms of the additional information that they may want from you, the main thing is an online provider form. So anyone that's looking to provide online care, there is an additional form, but you can't submit that at application stage. So it takes a handful of minutes to complete, but you just need to have that ready for them. Other things they might ask are questions relating to your existing application, and sometimes on occasion, not very often, but it has happened where they've asked for additional policies to be submitted, and they're usually quite bespoke or niche to your particular service. Although you've had to wait 6 to 8 months for the CQC to get in touch, they then request information with quite a quick turnaround, sometimes only up to 2 to 3 days. So that's why it's important at the later stage of that waiting game, you have, that you're aware of emails coming in and that you're ready to respond to them. Like I said, then they'll look to arrange the interview with you, and that usually happens within a couple of weeks, unless, for example, you're on leave or have extenuating circumstances. And you will then have the interviews for the nominated individual and the registered manager, and these will be separate, so they won't come together. And for everybody that we've worked with, depending on if you've been a registered manager before, level of experience, knowledge, size of the service, lots of variables, it can take anything up to 4 hours. So make sure that you have freed your time and that you're in a quiet and private space to take that interview. Then the inspector won't be able to tell you the outcome of the interview immediately, so they can't confirm that you are successfully registered, but you will then receive confirmation within usually about 2 weeks. And that will then give you your certificate to register that you're successfully registered, and then you can start practicing. So when we think about all of that put together, it's quite a number of months before you're ready to get going. There are processes to follow should you wish to challenge an outcome, so if you aren't successful in your registration, but it's really important to say that having worked in CQC and CQC services for a long time, sort of about 15 years now, I've only ever seen a handful of rejections, and they are for quite specific reasons, sort of demonstrating unsafe care and practice or providing incorrect information in the application form. So hopefully that reassures you somewhat, but we can help you if that happens. In terms of being interview ready, we're looking at kind of spring now if you were to submit this evening, but we will go through some top tips for you. So make sure that you have your ID to hand, and also it would be really helpful if you had a copy of your application form and your policies and procedures available, so that you know and you can refresh yourself of what it is that you've said in your application. Make sure that you have a list of the notification requirements. So the CQC have a number of notifications that you're required to submit to them once you're up and running, and they will form part of the questions that are asked. So it's important that, or it's helpful for you to have those to hand. And then thinking about having a list or access to your example quality statements that you submitted on your portal, and also a list of the fundamental standards. So one top tip that we always try and work through with clients is using the STAR acronym. So the situation, task, action, and results, and try to have a couple of examples that cover the fundamental standards or the quality statements ready to hand. So for example, if the inspector wants to talk to you about the process for managing safeguarding referrals, you will be able to explain a situation that's previously arisen within your work, or if a situation was to arise in your service that you're looking to register, what tasks would need to be undertaken, what actions you would then do as the registered manager, as the nominated individual, what actions might be delegated to other colleagues within the team, and then what you would expect a successful outcome or result to look like. So for safeguarding, obviously, would be for protection of adults against abuse and harm. So yeah, it's worth having some examples like that in the background for you. And then I think I mentioned already, but there will be separate interviews for the NI, the nominated individual, and the registered manager. There'll be separate Teams calls. It has sometimes been a separate inspector as well, depending just on probably capacity from the CQC. And the feedback that we've had is that they don't quiz you on the regulations as much as they used to. So what that means is they're not going to specifically say something like, please talk to me about Regulation 15, premises and equipment. They'll instead ask you to discuss quality statements. So it's important that the research and the preparation that you do in advance is more weighted on the quality statements than the regulations. And then just a few example questions that we've received from the registered manager who had their interview a couple of weeks ago, just to give you an idea of how that might look. So if you cease trading, how do you manage data? What would you do on a home visit if there was an incident? Can you discuss your patient pathway, and what's your process for managing safeguarding referrals? So that was feels like I've talked for a long time, and I'm going to hand over to Simon now just to look at success and what happens next. And I look forward to answering any of your questions.
Thanks, Gabby. That was great, and some huge amount of detail there. I learned a lot just going through that with you. Like clearly, the key lines of inquiry that we're also used to kind of referencing is a big no-no. So success. What's next? Once you've got through, and obviously, as Gabby explained, it's quite a long process. You will be potentially looking at the best part of a year from sort of start to finish, and thinking about CQC to applying to getting the interview to getting your certificate. So the work doesn't stop there. Once you've got that certificate, then what about ongoing compliance? It doesn't mean that you're then free to go. You do need to think about regular kind of check-ins to ensure that your clinic remains on track. And what about future CQC inspections? We'll touch on this in the Q&A because Gabby has some insight here in terms of there's no rhyme or reason, I don't think, in terms of when the CQC will come and do their first inspection. But you do need to think about the additional support that you may need post-registration. So that may be something relating to kind of consultancy and about the operational setup of your clinic in terms of, your team and your practice manager, your medical secretaries, perhaps your bookkeeper, who's doing your accountancy. I noticed there was a business continuity plan is needed by CQC. So these are the things that you may need to think about. What about your branding and website? So again, until today, I thought you needed a website until to apply for CQC. It is obviously clear that you don't now. It's just a domain name, and you can use the CQC's domain name should you wish to. Marketing and support. So what about launching your clinic? What about attracting new patients? On webinar 3, we talked about patient management systems. Again, you would need to probably document this in the CQC process, because where are you going to store the medical records? There are a host of patient management systems on the market for you to use. So that's something you need to consider. And what about HR, people management, practice management, medical PA support? All of these things you may need to think about. So so a huge effort, obviously, to get through CQC, but once you're there, there are other additional things that you need to think about. Okay, so Gabby, if it's okay with you, I will hand back to you just to go through the summary.
Yeah, of course. So yeah, hopefully everybody has taken on board some of the learning from this. The main things to bear in mind: always take time to know the CQC process, and remember that Designated and myself, at Let's Make Lemonade are here to support you through that process and understanding anything that you need to know. Preparation is key, so you can't delegate everything. You can't delegate somebody to write your policies for you and not know them. You can't delegate somebody to prepare your application form for you and not read it. You can't delegate somebody to do your DBS checks for you. So there is an element that you will need to be prepared and be involved, especially if you're then going to demonstrate to the inspector that that you will be delivering a safe service. So avoiding common mistakes, some of those we talked about. But yeah, if anyone else in the call has any other common mistakes or mythbusters they'd like to share, that would be really invaluable. As we've mentioned, please be prepared to wait. So don't have everything up and running. Well, if you can, you can, but it wouldn't necessarily make sense to have everything up and running and then hope to just get your application in and start working the following week. Use the period towards the end of the waiting time to get interview ready. So again, reach out to Designated and myself, and then think about what happens next. Common pitfall is that you are CQC registered, you're good to go, and then you don't think about what happens from an ongoing compliance and a success point of view moving forward. So I think that would be it. That would be my top tips.
Fantastic, Gabby. Thank you very much. If anyone does have any questions, please put them in the chat, and I'll pose those to Gabby or attempt to answer them myself, depending if they're. So there's one been put in the chat by Stefan. Would be nice to have a webinar about preparing for the first CQC inspection. So great idea. Yeah. We will talk to Gabby about that. She's just about to go on maternity leave, so maybe we have to wait until she gets back. But that's a really good topic. We will add that to our list, because that will be soon. I'll share a list of autumn topics that we're looking to cover. Now, over the course of the last 3 months, we had quite a lot of questions relating to CQC. So I'll just go through these briefly, Gabby. Maybe you can answer them briefly, and we'll just keep an eye on the chat to see what other new questions come in. I think we covered cost at the beginning, didn't we, in terms of the
we did, yes, yeah,
of locations. So we'll cover that. I think we covered the website one as well, that you can get away with just a domain name registration. What about preparing a quality statement? What would you recommend relating to that?
Yeah, so that again, the main thing is that so if you're preparing in advance using, like I said, a Word document, an Excel spreadsheet, a template of sorts, just have the quality statements down one side. Remember, there are 34 of them, and they fall under the 5 key questions that we'll be familiar with. So safe, effective, caring, responsive, and well led. There are a handful, or just over a handful, of quality statements under each of your key questions. So just have a think then about how you're going to meet them. So as I mentioned, if we use an example of listening to and involving people, so that's really looking at feedback processes, complaints, compliments, what options are available for people to provide feedback. So you'll be looking at things such as post-consultation text messages, post-consultation emails, forms for them to complete so that you can understand the quality of the service that you're providing. Do you have your complaints policy available on your website? Is there a feedback forum actually on your website as well? Have you made it clear that if people require accessible information made accessible for them, if they have various communication needs, will you be able to support them through that process? So support them through a telephone, making a complaint over the telephone if they can't, if they can't necessarily write that down or send that in an email. So making sure that you've demonstrated that you provide accessible services for people. you might then want to think about, okay, we've received feedback, what do we do with it now? So remember, we can learn from compliments just as well as we can learn from complaints. So is there any particular trends that we've picked up from the feedback we've received? What are we going to do with it to drive improvement, make a change to the way that we run? You know, an example recently from an inspection we did last week was quite straightforward, but a number of complaints came through that they found the map that was sent to people in advance wasn't easily readable. So people were then getting a little bit lost and a little bit flustered and then late for their appointments. So they updated the directions on the website and on the maps. So it's not huge, it's not necessarily groundbreaking, but it's really important then because patients feel supported through the process and they're able to then access their care and treatment properly. So you could talk about lessons learned and things like that. So that's just one example of one quality statement, and within, you know, a few hundred words you can talk about the steps that you would take to meet that.
Okay, thank you, Gabby. We've had a few more questions on the chat. One is related to kind of the building. So is it okay to submit the application while the building is still under renovation? It's from Christelle, that one.
Yes, to a degree. So you will need to have assurance. You'll need to be able to provide assurance of what steps are being taken to fit and kit that. So depends what level of renovation we're talking. If it's looking at ordering equipment relevant to deliver the service, then that's okay to obviously manage throughout the waiting stage. But you would need to have the actual building and the premises itself ready to operate. So if you need any more kind of specific with that, then feel free to email us. But it depends really on, when you say renovation, the level of readiness we're talking about.
Okay, thanks very much. Do get back in touch with us if you'd like to find out a bit more, Christelle. Is there a way, a really common question probably, Gabby, you get, is there a way to speed up the first interview so it's closer to 6 months than 8 months?
No, in short, no. So there is, via the CQC, there are ways for some services who are classed as a priority to register with the CQC, but that doesn't apply to independent healthcare. So unfortunately, no.
Can I just add something there? Because I was at a presentation recently and there were a couple of quite senior people from the CQC there, and they were quite apologetic about how long it takes. And they were talking about an aim to get back down to 10 weeks, and they're recruiting and they're training. But I think it's fair to say, Gabby, we've seen no evidence of that having any impact just yet. No. So I think that's probably a long-term goal rather than a medium-term goal.
Yeah. And it's very much, this is sector dependent. So obviously what we're talking about, this waiting list, is specifically for independent healthcare and GP services. You know, it's different in adult social care compared to ambulance services. So unfortunately, this is the waiting time that we're seeing for this sector.
Yeah, it's
no, Jane, that's very helpful. So apologies, Mo, but we can't answer there on that one. Tina's asked, what are the 5 things to cover in the quality statements? Is this on the CQC website?
So there are 5 key questions and 34 quality statements. So just to align that. So the 34 quality statements sit under the 5 key questions. In terms of a set number of things to cover under each quality statement, no, there's not kind of a pro forma or a checklist for every single 34 quality statements. It's just, as I mentioned, the example I gave earlier about complaints and feedback, it's just making sure that you have your processes, your policies, your learning and audits covered within that. So there isn't a specific pro forma, no, but on the CQC website, they do list the quality statements, and they then provide quite a lot of detail about what that is and what they'll be looking for. So it's always worth Googling and going on the CQC website and looking at that.
Right, thanks. A quick question I've just got for you, Gabby, is, bear in mind, obviously you've been working in CQC for a long time. What percentage do you think of independent practitioners go through CQC alone, so they take it on the process without any advice or speaking to someone like yourself? Is that quite common?
I think what's more common is that we come across people who have applied to register with the CQC later down the line. So they're then contacting us to say, we've got a registered manager interview in 2 weeks, can you please help us? Or we've not heard anything from the CQC, it's been this amount of time, what do we do? And, you know, they're sort of, but that might be 7 months in. So we're thinking, okay, any day now you're going to get an interview. Or it's, we're registered and we don't know what, you know, we don't know what to do next, or we've had an inspection or we've had feedback. So what I would say is always try and get ahead of the game with CQC compliance and embed it into just your normal day practice. You know, if you're having, when you're thinking about things like team meetings, one-to-ones with your staff, business development, all of the things that designated offer support with, build the CQC into that rather than seeing it as a separate entity, and it will make your CQC compliance journey much, much easier.
And you touched on this, Gabby, in the presentation around with the new single assessment framework. What happens regarding sort of rejection of an application? I know you said it doesn't happen very often, but if you haven't correctly or it's missing something, what is that process and how quickly can you amend and fix, you know, or I guess add the information that the application is requiring? Do you get that kind of opportunity?
Yeah, so again, it's proportionate. So the CQC inspector can reach out to you, sort of mentioned at the latter end of that waiting time, and say, we've noticed that the following, you know, maybe 2 things don't align, or we just want to ask a specific question about this particular policy, or in this you've said, you know, Mrs. and another you've said Miss or something. It can be quite minor like that. You will get an opportunity to then respond to the inspector in an email chain and amend that. But what that's different to being rejected after you've had your registered manager interview. So if they have the interview with you for the nominated individual and the registered manager, and then they advise that you haven't been successful, then there is a process to follow, a challenge process, which, yeah, again, we would support you with, but that's more of a formal kind of legal challenge.
Okay, great. And then, and final question, I think, so we haven't got anything more in the chat, and just mindful of time as well. CQC inspections, once you've got through, you've got your registration, typically, is there a time frame that CQC work to in terms of delivering or going after that first CQC inspection? Is there any advice you can offer around that?
Yes, it's a great question, and one that's quite, it's changing at the moment. To a degree, the CQC is setting out, and they've assured us that they're going to provide timeframes for inspections for newly registered services, for services that have breaches or requires improvement or inadequate ratings. They aim to do the first inspection within 12 months of registration, and that would cover all 34 quality statements. Then after you've had your first inspection, so that's previously it's what you might have known as a comprehensive inspection. Once you've had that, then the new single assessment framework and the new way of working means that it's unlikely that you would get another comprehensive again for many, 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 many years. But instead, you would have focused inspections where they look at particular quality statements. However, I have more examples than I can count on my hands of providers that are waiting sort of 2 to 3 years for their first inspection from the CQC in independent healthcare. So the goal is 12 months, but it's not. There's very, very little evidence at the moment so that target is being met.
Okay. Gabby, thank you very much. I think you've spoken enough for this evening. Thank you. An arrest. Thank you very much. Just to finish off today, next steps, if you anything that's come up today that you want to ask some more information about kind of CQC and the process, do get in touch with us at info@designatedmedical.com. You know, we've got a whole team that go through this day in, day out. So if we don't know the answer ourselves, then we have a team member that certainly will do. Don't forget to join our private practice success WhatsApp group. So that's obviously free. We use it to keep in touch, ask questions, share information with colleagues that are going through the same kind of process that you are. Autumn webinar. So we are going to take a well-earned break for the summer through July and August, but we will be coming back in the autumn. We've had quite a lot of suggestions, but we want to hear from you. So do let us know what you want to hear. I think there's already been one posted on the chat tonight regarding CQC inspections and preparing for that. One was around private medical insurers and the process that you need to go through to register with them, the best way of doing that. We have a team that look after that here at Designated. So we think that's a good topic that we're going to cover. Indemnity insurance is another area, and all the other insurances that you may need to consider. So we can do an in-depth session around that. Clinic property, again, a question came up in the chat tonight about kind of like, can you apply through CQC if you haven't got a fully refurbished clinic? So that's something I think we can cover in terms of fit outs, facilities maintenance, CQC compliance. We had an email this week about clinic concierge services, introducing AI to your practice, and then doing more around the marketing. So the differences between sort of search engine optimization, Google advertising came up as well. So there's a whole host of topics that we could go into in the autumn, but we really want to hear from you. So do get in touch with us, and we will do our best to announce probably over the summer our September and October series. Here's our contact information, our phone number, website, and email address. So do get in touch with us. We are around. We will make this recording available as well. So if you want to, I know there's an awful lot of depth that Gary went into today. So if you do want to reference it, then we will send you the link after the event. Do pass on to your colleagues as well that maybe couldn't make it this evening that are going through CQC. And we hope to see you after the summer at the next one. So thank you very much for attending. I think we've got a couple of minutes left before our hour is up, and we'll see you next time. Thank you.